Nicole Borzone, and I'm validating for a peg for feeding tube. So I would check my patient, check the doctor's orders, make sure that the patient was correct. I would bring my patient up to a working height. Make sure that she's at a 45-degree angle, because you don't want her to aspirate onto the stomach contents. Alright, so I would wash my hands and put on gloves. I'm going to assess her site to make sure that there's no stomach distension, that there's no redness or anything, that the dressing is nice and clean. I'm going to check for bowel sounds, but we're going to turn off the feeding tube. We're going to kink. So we're going to assess for bowel sounds. Clean off my stethoscope. You want to make sure you do all 4 quadrants. Sounds good. Now we're going to put check the pad on. Alright. I'm going to kink the tube. You're going to aspirate your stomach contents. It depends on your facility. You would either reinstill it or you would discard it. If it's more than 100 cc's, you would discard. Let the doctor know, because they are not digesting their feeding. We're going to discard it. Kink. Then with sterile water, 30 cc's of sterile water. We're going to irrigate it now. Put in the water, squeeze it. In the water, cleaned out. Reconnect your feeding tube. Then you would take off your gloves, wash your hand, clean up off the equipment, lower your patient down, make sure that she stays elevated at a 45-degree angle so she doesn't aspirate on anything. And then now is when you would, if necessary, fill up or add more feeding to your tubing and turn on the pump. And that's it.